I'm Dr. Brian Prax, and author of this book, Reversing Neuropathy, Making the Impossible Possible. Is this what your nerves are looking like? I just came back from an amazing vacation, went to Mexico, had a super duper great time, and I come back to my favorite plant looking like this. This is my favorite prized plant, and I really don't have a green thumb. My staff usually takes good care of it, but we took a couple weeks off. Came back and discovered that the shades were down, and this is dry as a bone. And this is what we come back with, and we realize, wow, we are in a serious situation. And I use this as an analogy all the time because this is very similar to humans when it comes time to many things. But since I'm the expert with neuropathy, we'll talk about neuropathy and those damaged nerves. Some of you have nerves that are this bad, right? And if you have nerves that are dying off like this, I mean, look at this poor leaf right here. Is that going to come back? We got brown over here. When I left, this thing was up. It was erect. It was super healthy. It didn't have any bit of yellow or browning. It certainly wasn't over like that. So I come back. We're in an emergency situation. The question is, what do we do about this? If it's your nerves, what your doctors will first do is run some tests, trying to rule out things like diabetes or maybe chemotherapy-induced neuropathy. And then what you usually get back is you have neuropathy, your nerves are dying, there's nothing you can do. And I beg to differ. I've been working with neuropathy since 2010, and for those patients whose nerves aren't completely dead, we can help them. Now I ask you this, I just want you to think about it. Do you think you can help this plant? That's a question you have to think about. Look, it's still alive. May not look so pretty, but it's still alive. And if we give it what it needs, right? Now again, I'm not a green thumb, I don't have a green thumb, but I know a few things. I know this plant needs water. Okay, we usually water it once a week, pretty good dose. And then it needs sunlight. So we know what it needs. We need some good soil, and we need not to trample on it, right? So maybe animals are trampling on it. Well, not here in the office. So the first thing I do when I come in is like, oh my gosh, we left the blinds down. Let's get it some sunlight, okay? But of course the medical approach though is always a drug, so trying to get a drug solution, maybe surgery solution. So with neuropathy, this is nothing that can be done. We can give you gabapentin, that'll make you feel a little more comfortable. There's no surgery to bring back deadened nerves like that. Learn to live with it, right? Have you heard that before? Just learn to live with it. Here, try this gabapentin, try that. Make you feel a little loopy, a little tired, tripping over your words, tripping, right? But obviously there's no medicine that's going to help this. I mean, if I wanted to look pretty, I suppose I could spray paint it with some green paint, try and match that real good. I guess I could get some sticks here and prop these up, right? I could prop them up, make it look good, take some pictures of it and say, there, doesn't that look better? Well, that's just not going to work, right? We're just treating symptoms. It's not the symptoms, we have a systemic problem. For some reason, this plant is not thriving, and that's the same exact thing with your nerves. Here's the approach that we take with neuropathy, okay? Just like with this plant. We need to give it what it needs. We need to give this plant, we need to give your nerves what it needs. Number one, it needs light, okay? So first thing we do, simple, we walk right over, we go, goodness, let's bring in some light. And we obviously don't want too much, but that's an environment that this plant is acclimated to. So let's first give it what it needs. It can now start doing photosynthesis. Cool thing is, a great analogy right here is with our neuropathy program, we use light therapy as well. It's called infrared light therapy. And what that does is it stimulates circulation. That's perfect segue. So circulation is getting blood down to those nerves, whether it's your hands or your feet. We need to make sure we have a good circulation. Well, that's just like this. Circulation is water. It needs to have water. So if there's typically a hose that's kinked or somebody forgot to put water in there, we got to improve that. So a couple minutes ago, I put some water in there, right? So now we got the light, we got the water. What else? What else does the plant need? Well, make sure nobody's trampling on it, or animals or anything like that. I might need to put a fence around it. I might need to protect it. I might need to stop, some of the damage that's done to it. So for neuropathy, sometimes people get neuropathy due to diabetes. That's the number one thing. Well, that's a problem with what you're eating. Okay, I hate to break it to you, but it's what you're eating. You ate your way into it if that's what you got here. Maybe you have Agent Orange induced, you got Guillain-Barré, you got chemotherapy induced, you got mold induced. Well, we need to figure out what those things are and stop it. If you have mold in your house, we got to figure that out. We got to stop the mold, right? So same exact scenario right there. So as far as this plant goes, without having that green thumb, I'm just gonna kind of hope, maybe I'll pray, but I also just know that nature has an amazing ability, which is called adaptability, survivability. This plant just wants to survive, and so do you. And you can't survive very well if you're all limp over like this. It's not a good way to survive, okay? And for you and your nerves, you can't survive very well if you can't feel your feet, because then you're gonna have balance issues. And balance is bad because you can't run away from the saber-toothed tiger or an oncoming bus, okay? So we need to make sure that we allow nature to do what it needs to do. So the first thing we need to do is figure out what's causing your neuropathy, okay? And then we need to figure out what does the body need. So just like this plant, we restored the sunlight, okay? We gave it some water. At this point, we just have to make sure that it's well nourished, that the soil is good, that we continue to water it, not overwater it, but certainly not underwater. We need to put this plant in an optimal environment. That's really what we need to do. And then at this point, we simply need to wait. How long is it going to take? I'm thinking it'll take several hours. The sun's going to go down here pretty soon, but I'm thinking by tomorrow, I'm thinking this plant's going to be right up, bright, and ready to go. That's what I've seen. I've done this a couple times already, but that's what I've seen. Now with neuropathy, how long can that take? Now we have science behind all of this stuff, and we go into it a lot more detail. But there's a chart right here that would actually detect how bad neuropathy is, whether it's just a little bit of loss of nerves or all the way up here permanently damaged. And I'm sorry, I don't know if you can see that or not. Just know that there's science behind that. If you have severe neuropathy and you got brown leaves and there's hardly any leaves left, you know what? We may not be able to bring it back and restore it exactly the way it looked when we started. But if it's like this plant, I would say this is probably moderately damaged right here. We've got a good chance of bringing it back. Is it going to come back 100%? I hope so, but it may only come back 90-95%. It might take months for this thing to recuperate from this. This leaf we may have to cut off. This one right here probably got to go. A bunch of them back there. This looks like it's fallen. I hope it isn't a permanent injury. But the point is if we give it what it needs, maybe in the case of the nerves, if we utilize some technology, this would be like maybe some fertilizer, some B vitamins, things like that, we can actually speed the process along. And we've been doing that with neuropathy as well. So this is the plant analogy, very similar to your neuropathy. Can your neuropathy be fixed? We have to determine the level of damage, all right, and figure out how far along that is. Now we're going to have to make some changes. Okay, if you've been, we may need to look at diet. We might need to look at other scenarios that could be causing damage to that. But I give this plant a very good diagnosis with our good care here. I really think we're going to bring it back. I don't know about your neuropathy. We would need to test it. But if you're within that moderate to not too severe range, then I would give you a good to great prognosis as well. So I really hope that analogy works. How bad is your neuropathy? You need to do an exam to test it. If you're interested in learning more about that, you can certainly give my office a call. The number here is below, 434-977-5433. You can also check the links below. I've got a Facebook page, a YouTube page. Got lots of videos out there, and I even have a book. Well, obviously I just threw it over there, but it's called Reversing Neuropathy, and we'll put a little link down at the bottom as well. Anyway, I hope that helps, and I hope that brings about hope that, like this plant, you too can heal up from even damage like neuropathy. Bye for now, and we'll talk soon. Thank you for watching this video. If you like the content, I would ask you to hit the thumbs up button to like it. You can share it with a friend, subscribe to my channel, and please comment below. I will read it and I will respond. Thank you and have a nice day.